Hi, this is Kate Evans, and I'm going to be presenting on fluphenazine, also known as Prolixin. So, what is fluphenazine and why is it used? You may think, oh, well, it's probably just used to help with flu symptoms. That is incorrect. It is helping schizophrenic symptoms. So, fluphenazine is what reduces the schizophrenic symptoms of hallucinations and delusions. People with schizophrenia have an imbalance of the neurotransmitters glutamate and dopamine, and there is too much dopamine. So fluphenazine is what's going to block those D1A and D2 receptors. So this means because of this blockage of dopamine, this is a direct antagonist. And the areas of the brain that it is affecting is the limbic and cortical system and basal ganglia.
Dopamine has received much of this attention, with the general hypothesis being that dopamine activity is too high in certain parts of the brain.
So the side effects of this drug are ranging from smaller side effects to larger ones, and the most common side effects tend to be minor, such as sweating, lethargy, loss of appetite, constipation, and other similar symptoms, which isn't fun, but they are on the more minor side compared to what can happen with long-term use of fluphenazine. It can result in tardive dyskinesia, which is a movement disorder, causing tremors, shakiness, and other similar symptoms to Parkinson's disease. There are two different concentrates of this drug, which is just the way that they are preserved, and the two concentrates are decanoate and enanthate. And decanoate is the more often used because of the longer duration and the fewer side effects of movement disorder that it has. So if you're looking into this drug, this is what I and professionals would recommend, but of course only with a doctor's referral. So there are two different types of administration forms, one of these being intramuscular injection and the other one being oral administration. So this is an injection that will go straight into your muscle. The advantage of this is over oral administration is when treating schizophrenia, it reduces poor compliance because oral administration can be easier to forget and easier to refuse. Now on to absorption. Fluphenazine for intramuscular injection slowly begins to absorb from the injection site, then absorbing into the blood and circulation directly from it, making it the faster absorption process over oral administration. Now duration. The half-life is 9.6 days after intramuscular injection, and it is eliminated within 19.2 days. So that means that it will be in your body for well over 2 weeks. Now on to distribution and elimination. Intramuscular antipsychotics are the same as after oral dosing and may avoid first-pass metabolism in the liver, which increases their bioavailability relative to that achieved after oral dosing. This form of absorbing faster means the patient will experience symptom relief quicker. This is eliminated by being excreted through urine and feces. Now on to oral administration. This is usually taken through a pill or a tablet.
Here we go.
So the absorption and distribution for oral administration is if used orally, it'll be absorbed from the gastrointestinal tract, beginning by passing through the liver and intestines, and the liver metabolizing it, and lastly reaching the systemic circulation. Now onto the duration and elimination of oral administration. The antipsychotic fluphenazine orally has a half-life of 6.8 days, and then it is fully out of your body and eliminated by 13.6 days, so almost 2 weeks. And this is very obviously shorter duration than the intramuscular injection. This will be eliminated through the kidneys and liver and will be fully excreted through urine and feces. Lastly, all of my references to show I did not make all of this stuff up. Get ready, it's retrieval time. What is the concentration form suggested to take if using fluphenazine? You got it right, it's decanoate.
Yay!
Now on to the next question. What mental illness does fluphenazine treat? You got it right. The answer is schizophrenia.
Yay!
Thank you so much for listening to me talk for 5 minutes. I hope you learned at least one new thing about the drug fluphenazine. Thank you.